Today I am going to demonstrate how to administer breathing exercises. Breathing has two phases, inspiration and expiration. Inspiration means taking in air and expiration is taking out air. Inspiration is an active process implying that it uses muscle work. Diaphragm is the prime mover of inspiration. Expiration is a passive process, meaning that it does not require any muscle work. It is achieved by the elastic recoil of the lung and the chest wall. Breathing exercises is actually a misnomer because exercise means something with which we exert the body. But breathing exercises are given not to exert the body but to relax and achieve a smoother pattern of breathing. Many respiratory disorders like asthma, bronchitis, emphysema, etc., they disturb the respiratory pattern of the patient. The patient expends too much of energy and effort to achieve a smoother pattern of breathing. For such patients, breathing exercises are prescribed. Diaphragmatic breathing exercises are the most preferred type of breathing exercises prescribed to a breathless patient. Now I am going to demonstrate how to give diaphragmatic breathing. What is the correct technique of giving diaphragmatic breathing exercises? Diaphragm, when used as prime mover of inspiration, reduces the energy cost of breathing. Some people, when suffering from respiratory diseases like COPD, have a very disturbed respiratory rate and they tend to use the accessory muscles of respiration more. Using accessory muscles of respiration increases the energy cost of breathing. So therefore, to achieve a smoother pattern of breathing, diaphragmatic breathing should be prescribed for such patients. Let us begin. First of all, we need to take care of positioning of the patient. This is how I have positioned the patient. This is semi-reclining position. We can also use supine lying or we can also position the patient in high sitting. We can also ask the patient to sit on a chair with a high back support without the armrest. So here is the patient positioned in semi-reclined position. While positioning, we have to take care that the patient keeps the muscles of the neck and shoulder relaxed. This is essential in order to reduce or in order to totally obliterate the use of accessory muscles of breathing during respiration. Further, since diaphragmatic breathing will be using the abdominal muscle wall, we need to ask the patient to keep the hip and knee slightly flexed. So the patient's hip and knee should be slightly flexed. We can also keep 1 or 2 pillows for support. Now let us begin. The instructions that need to be given to the patient are that he needs to concentrate on this part of the abdominal wall. The excursion of the diaphragm during inspiration is that it descends. It descends by contracting around its central tendon. Now, make the patient understand in his language or in layman's language, we can simply ask the patient to concentrate on making this part of the abdominal wall protrude out during inspiration. Therapist positioning. How should the therapist position himself or herself? The best position for therapist is to stand in front of the patient so that I can see the facial expressions of the patient and I can also observe how well the diaphragm is moving. I will keep both my hands on the anterior chest wall of the patient. I will ask the patient to turn his face away from me. मुंह उधर मोड़ लो. And I will ask the patient to start by first breathing out and then taking a deep breath in. पहले मुंह से सांस छोड़ो, फिर धीरे से नाक से गहरी सांस लो. I have asked the patient to first breathe out and then breathe in. Breathing out should be done through mouth. Breathing in should be through nose. While I keep my hand over the anterior chest wall, I try to feel the excursion of the diaphragm, how well the diaphragm is moving. गहरी सांस लो. जब सांस लोगे इस पोर्शन को ढीला छोड़ना. I have instructed the patient to keep the upper chest wall relaxed so that there is no excursion of the accessory muscles of breathing. Now, when the patient masters this technique, we can also add some resistance while giving diaphragmatic breathing. Resistance can be given using the hands, that is, I can put slight pressure during the inspiration. When the patient is taking an inspiration, I can exert slight pressure with my hands and release it as soon as expiration begins. I can also put some weight in form of a book. I can also give a stretch while putting pressure to facilitate the diaphragmatic contractions better.